Good morning, friends. This is Dr. Shwetab. I am currently pursuing dermatology. Before that, I have also done DCH and MD Pediatrics. I am going to make this series of videos in which I will be discussing about a series of interesting cases which I have come through in my residency days. So, without wasting time, I will be discuss. This is the first video of this series, and so this I have titled this as the curious case of non-healing ulcer. So what happened about 2 to 3 years back when I was doing my MD pediatrics at SAE Medical College Cuttack. One day when I was sitting in the OPD, a girl of about 8 years came to for consultation to me. Uh, as we generally know, if a child is of 7 to 8 years, then they can walk and run easily. But this was a girl child, and the parents have come while holding her in the lap, or I will say by sides. So they come to me, and in the OPD they showed their her foot to me. In her foot there is an ulcer of about 5 centimeter into 5 centimeter of size. I mean, it is such a big ulcer. I was a bit surprised because the family was looking well to do. Generally, what happens that if there is lack of hygiene, or if the people are not maintaining proper hygiene, then such a type of ulcers can form. But this was a good looking family, and the girl was well dressed. Family was also well dressed. Still, she was having ulcer. They asked about, sir, what to do about ulcer. Uh, so I looked at the ulcer, and I was unable to make that what has actually happened, which has led to the formation of the ulcer. So I asked about history of trauma. There is no history of trauma or injury of or fall of any side. Then for a while, but I thought that what has happened actually to the girl. So was it due to trauma? It was not. And what it due to some diabetes? It was such a big ulcer like that happens in diabetic patients in the in the elders. But there was no history of diabetes, and obviously this is very unusual to have such a big ulcer in a small in such a diabetes in such a small child. So diabetes was also ruled out. So I thought of is the girl having HIV or some immunodeficiency which leads to infections. But there was no obvious history of it. This all things were happening in my mind in during 30 seconds to 1 minute. I was trying to figure out what was the etiology which had led to the formation of the ulcer. Then I thought it is probably some CNS cause. Most probably, the girl is not able to sense the feeling of being hurt at the leg, and so small trivial injuries have culminated and lead to the ulcer. So, what can be the cause? This was the issue. As the girl was had normal sensorium, I was talking to me well, so it was clear that a CNS was not involved. So the next in line was spinal cord. So why this an issue of spinal cord? It was difficult for me to figure out, but still I thought, and I asked why the girl having some issue in the spinal cord or back, and to my surprise, the parents told yes, the girl had meningomyelocele, which is a condition in which the contents of the spinal cord herniate through the back. As we all know, we have brain and spinal cord as a central nervous system, in which if spinal cords herniate along with the covering, then it's known as meningomyelocele. And uh, surprisingly, I came to know, I saw that that girl was unable to was having paraparesis. That means that she was unable to move her both the limbs. So the whole case becomes clear to me that girl was basically having meningomyelocele, due to which she was having a loss of sensation of the bilateral lower limbs, and also loss of the urination and defecation. And hence what was happening is that the girl was getting small trivial injuries in the legs. However, due to loss of sensation, she was unable to respond to them. Moreover, dribbling of urine was making the matter worse, and she was having infection and gradually was having such a big ulcer. I asked them about the history, and they confirmed the same. They said that girl was having meningomyelocele and was operated at the time of the infancy, but it was a failed operation, and hence the girl was having such issues. So sometimes what happens that this type of small cases comes in which we apply all our brain, and ultimately we get to the diagnosis. The diagnosis was known well before to parents, but this in the 30 seconds or 1 minute in which I thought what was the case that I want to tell you. So coming small part to meningomyelocele, basically as I said, it is due to herniation of the contents of the spinal cord, And the surprising part is that the folic acid deficiency, which is a type of vitamin, is one of the most important causes of the preventable cause of the having such defects, which is menjumanosin. So it is very advisable that all couples who are planning pregnancy should start taking folic acid 1 month before they are planning pregnancy to the 3 months after the pregnancy. Now you can say that, sir, why to start before 1 month? The reason is because the brain formation takes in the initial 4 weeks of the fetus formation. So by the time one knows that the she is going to she is pregnant, already 1 month has passed. So if someone is planning pregnancy, so better to start it before 1 month and to continue till three months afterwards. So this was an interesting case which I have come across. I will be discussing more such cases in the consecutive videos. Thank you.